The verdict is in on the holiday carnival. Police investigate the country's latest homicide, and downtown has a new holiday glow. Good evening, everyone. I'm Leah Cooper with your Jcn News for this Thursday, December 9th. Well, if you were looking forward to the return of the holiday carnival this year, we have some bad news as the verdict is in, and the Christmas holiday carnival will not be permitted to operate in the country. The Ministry of Health and Wellness has decided it will not give approval for the holiday carnival to be held this year. That announcement came by way of Clint Watson, press secretary in the office of the Prime Minister. Mr. Watson telling reporters during OPM's weekly press briefing that the advisory committee has not been meeting since the start of the pandemic and would be the body to give the approval for events like this, has identified several reasons why this event should not be approved, citing that the Ministry of Health was not satisfied that people from separate households would remain 3 to 6 feet apart, a key tool in the fight against COVID-19, as the carnival falls into the same category as concerts and large events.
Two main groups that being children age 11 years and younger adults have been identified as vulnerable groups who could be negatively impacted. Specifically, children age 11 years and younger do not have access to any vaccines against COVID-19 in the Bahamas, which leaves them susceptible to contracting the virus and spreading it. For younger adults, they've been identified by data as being the largest group of individuals who have tested positive for the COVID-19 virus across all three waves.
Now, while it was reported that the Prime Minister had given approval to the carnival owners, Health and Wellness Minister Dr. Michael Darville has gone on record to say that health officials had not given the go-ahead as yet for carnival. Dr. Darville also noted that the committee was still waiting for the company to fulfill outstanding requirements. That said, the advisory committee notes that while the organizers have stated that they are committed to implementing measures to enforce a protocol, it was not satisfied that they would be able to consistently and safely enforce rules, even if motivated.
During the application process, the responsiveness and behavior of the persons associated with the request for approval has been less than ideal, as emails have gone unanswered, and the illusion made in the press that the Ministry of Health and Wellness does not have any jurisdiction on the holding of the carnival has given rise to concern of the level of regard for this ministry that is required for the ministry to have confidence that it can help organizers manage and guide this event safely.
Health officials add that the number expected at the carnival has not been provided by the organizers. However, it is anticipated that the numbers exceed that seen as high risk for concerts and other large outdoor events. Well, our news team went to the carnival site to speak with the organizers following the Ministry of Health's rejection. Here's Laurencia Smith with the carnival rep's reaction.
We are still working on his decision, so no comment at this time on anything.
That's Carnival manager Joseph Albert following the verdict on the holiday carnival being denied by the Ministry of Health and Wellness, which was announced by the office of the Prime Minister's press secretary Clint Watson on Thursday. Now, Mr. Watson was pressed by reporters to get clarity on who gave the approval for the carnival officials. However, he gave this explanation.
You can come to the country and say, I want to come to try and set up shop, to do something particular. You're not breaking the law by doing that. Particularly if you follow the customs requirements and approvals to get a particular facility, you can do that. There is no harm in that. Those agencies are not going to say, "Where's your health approval?" That comes from a whole different sort. So my thing is, at the end of the day, what needed to be sourced first was that health approval before taking everything else. Everything else was done the other way around, and the health was the last thing for them to respond to.
On the other hand, the carnival organizers have already set up shop with rides and other amenities ready for the December 10th opening day. Reporters asked Mr. Albert what's next, as he says it costs the company a couple $100,000 to be here.
We're going to work on it and see if there's any. We invited them to come out and look at it and see how they like, how safe it is. So maybe they will talk to other people in the political platform.
Meantime, with a number of events set for the holiday season, Mr. Watson says the ministry has over 200 event applications that they have approved. I'm Laurencia Smith For JCN News.
In the race to get 200,000 Bahamians and residents vaccinated by the end of the year, co-chair of the National Vaccine Consultative Committee, Ed Fields, says the country is deep into the hesitancy pool of individuals for various reasons. That said, he adds that the committee has to determine how best they can incentivize those sitting on the fence. In light of this, Mr. Fields announced that the committee has teamed up with the Fox Foundation that has given a donation of $100,000.
And so essentially for first dosers, and this is for first dosers only, it sounds like a whole other thing. For first dosers, we are going to be incentivizing them over the next 3 weeks from Monday to the 31st of December at a rate of, we're going to issue out $500 prizes a week. And then at the end of the period, there's going to be a grand prize for those who were in that pool between the 13th and the 31st of $25,000. So it's fun. So we're hoping that we can just drive the number.
He says the country is at about 150,000 vaccinated at this time, and that means the committee has a big push to reach that final goal. He says this much during the office of the Prime Minister's weekly press briefing this morning.
And if we do it, that means that we've arrived at about 60% of the eligible population for vaccination, somewhere between 50 and 60%, which is a huge undertaking given the fact that the United States is right now stuck on about 59, 60%. So if we can get to that level, we're going to be right up there with the big boys.
He adds that the committee will be running the booster program and the incentive program simultaneously. This incentive applies to all vaccines available in country. The winners will be chosen through a digital drawing weekly, and the results will be posted on ILTV channel every Saturday. With more and more positive cases emerging across the globe, the Bahamas can breathe a sigh of relief as there is currently no evidence that the Omicron variant of COVID-19 is in circulation in the country. This much coming from the Pan American Health Organization's Regional Director for Viral and Emerging Diseases. That's Dr. Jairo Andres Mendez Rico.
The Bahamas has been very active shipping samples for genomic sequencing to either of the reference laboratories from the PAHO Genomic Surveillance Network, and that allows us to follow what variants are actually circulating. So far, the Delta variant is predominating not only in the Bahamas, but also in all of the Caribbean subregion and in the Americas. Regarding specifically Omicron, we don't have any evidence of detection or any signal of circulation in the Bahamas. On the other side, until now, we don't have information to think or to infer that this variant is more dangerous. In fact, most of the cases so far have been detected in mild or even asymptomatic cases. Of course, as Dr. Adiyeri already mentioned, we need more evidence regarding clinical facts, and this information is still to be collected during the next weeks.
You're watching JCN News. Stay with us.